So a big welcome to everybody. Thank you for staying home on such a miserable night and coming in this way, as it were. The meeting this evening is basically an opportunity for us to receive an update on COVID, including the vaccine, the booster and flu as well, and to understand more about the winter pressures, particularly in health and social care and other public services. However, it's also an opportunity to share any concerns or pressures we're facing in our communities, as well as thinking about how we can help others and work together to play our part. At the end of the presentations, there will be an opportunity for questions to be asked, but we'd also really welcome hearing from you about ideas, issues, concerns that you have from your communities. Our speakers this evening will include Will Godfrey, the Council Chief Exec, Becky Reynolds, our Director of Public Health, Jill May, who is Director of Nursing and Quality for the CCG, and Corinne Edwards, and our Cabinet Member, who I think by default, because he just happened to turn up, but most welcome, Tim Ball, who will pick up the matters under the sort of councillors' issues. The timing looks as though we should finish by, I think, 7 o'clock. So ideally, we will aim for that, folks. And I think the easiest thing now, if you're ready, Will, is that we hand over to your good self to initiate this part of the meeting.
Brilliant. Okay, thank you very much, Councillor Hale, and good evening, everybody. Can we get, have you got the presentation, Sarah?
I think it's just about to come up.
That would be helpful. Excellent. Okay, go down to the. Okay, so as indicated, this is basically what we want to try to do tonight. We just want to, be very open and honest about some of the challenges that we've got. So we're gonna talk about the vaccine programme and where we are with that. And obviously, the last few days has probably brought even more focus on the vaccine programme. And I'm sure Jill May will give you some more detail about that. From our perspective, the last sort of few weeks, the COVID rates in Barton Somerset have been pretty high. Thankfully they've reduced relative to other areas in the last couple of weeks, but they're still high compared with where we were, sort of 12 months ago or so. And we've already now begun to see, haven't we, the weather getting a bit worse, and obviously that brings on the dangers of winter flu, etc. And again, I'm sure we'll have a bit of an update about that. We also then want to talk about the pressures in terms of service delivery. And again, just to be really clear with people, we are still experiencing a very unique set of circumstances that, to a degree, I think are actually more difficult now than maybe they were 12 months ago. Lots of those issues have sort of come together, and it is putting real pressure. So we just want to be really clear about where those pressures are and give you an understanding of that, and ask you, I suppose, to help us to make sure that that message gets out to people. And then we'll touch very briefly upon the council budgets. There will be a special separate session on the budget on the 14th of December, but I will give you a little bit of context about the position the council is facing in terms of its budget, which hopefully will give you a little bit of preparation for the meeting on the 14th. And then we just want to talk a little bit about how we can all work together to do that. So can we go on to the next slide? So I'm just going to pass over to Becky Reynolds now, Director of Public Health, to give you a bit more of an update around COVID and where we are at the moment. Becky.
Great, thank you, and thank you very much for inviting me along as well. I've just got 2 slides to go through. So I was going to first of all talk about this slide and the information that's inside that box there. So our rates at the moment are actually a little bit lower than that when that slide was put together this morning, because updated data has come out this afternoon. So they are under 400 now, which is really positive. And we've seen a slight downward trend ever since we had that incredibly high rate of over 1,000 per 100,000, if you remember, a few weeks ago. So in the most recent 7 days, we've had 791 confirmed COVID cases. So our rate is just under 400,000. England is 440, and England's rate has been increasing for the last few days. And the Southwest is currently a bit higher than the England rate, and it's 519, and that's been staying fairly level. On the right is a reminder to me to talk about testing, because you'll have heard that certainly in terms of rapid asymptomatic testing, you may well have heard that the national messaging about that has changed slightly in the last couple of days. So we know that up to 1/3 of people who have COVID don't have symptoms, and so then are potentially able to pass that on to other people. So the rapid tests, the LFDs, lateral flow tests, lateral flow devices, help us to identify whether or not we have COVID if we don't have symptoms. So the new recommendation is for us to all take lateral flow tests before times of high risk, and if we're going to meet vulnerable people who are at high risk of getting seriously ill. So before times of high risk, meaning if we're going into an enclosed space, or if you're going into work, or if you're going into a shopping centre where you know there are going to be lots of people around. And then the other thing is if we're going to be meeting elderly people or people who might get really quite seriously ill if they get COVID. And it's important to remember that we can all still get and pass on COVID even if we have been vaccinated. The vaccine is fantastic at helping prevent us, reducing the chance of us getting severely ill, which is fantastic, but it's less effective in terms of stopping us from getting COVID in the first place. But it's very, very effective at stopping serious illness. So those rapid tests can be picked up in a number of places. We have an outreach van, and that picture there of the green van is the outreach van. The outreach van specifically is trying to target people who wouldn't necessarily pick up lateral flow devices from pharmacies or from other centres. So we're particularly targeting people who've got disabilities or impairments, people who may be experiencing homelessness and rough sleeping, people who are in contact with the substance misuse services. So if in your area, if around the sort of Keynsham, Salford area, there are some specific sites where you would really think it's quite useful to try to get the outreach van there to meet people who wouldn't necessarily go and proactively go and be able to go and get them, then do please let Sarah know, and she'll pass it on to the public health team. Now, just before I move on to the second slide, I just wanted to mention something about Omicron, because on Will's slide a minute ago, it said COVID is still with us. And goodness, haven't we been reminded of that over the past few days with the new variants that we've all been hearing about. So just very briefly, it's a rapidly evolving situation, as we all pick up from the news, and the BBC is one of the most excellent sources of keeping up to date with what's happening with regards to that COVID variant called Omicron. I think we'll all have heard that its genetic profile, what its genetics look like, has raised some concerns. But there is absolutely a shortage of real world data at the moment. It's much too early yet to know what the impact of that variant is going to be. So we don't yet know whether it transmits more easily, and if it does, how much more easily. Theoretically, the mutations on it do mean that that it could make the vaccines less effective. But if that's the case, we don't yet know how much by, and we don't yet know whether this variant causes more severe disease. So it very much is a watching and waiting. And so the government has put in place a lot of precautionary measures, as you'll have heard, in terms of making face coverings mandatory in certain settings. The other thing I just wanted to point out is that if there are confirmed cases of this particular variant, or if people are considered highly probable as having it because of what some of the early material that's coming back from the lab. So people who've got COVID and people for whom it's highly suspected that they may well have this new variant, there is a change in their contacts. So contacts are then asked to isolate for 10 days, whether or not they've been vaccinated. So that's different. So if somebody is a contact of someone with the ordinary Delta virus and they're vaccinated, then they don't need to self-isolate. But if somebody is a contact of someone who has or is very likely probable to have this new variant, then they will be asked to isolate for 10 days, even if they've been vaccinated. And that is really to try to get on top of and control the spread of this as quickly as possible, to give scientists more time to find out more about it and to give time for the vaccination programme to roll out. Just to say that at the moment, there are no notified confirmed cases in the Southwest yet, to my knowledge. Directors of Public Health are notified at the moment straight away when there is a new case, and I've certainly not been notified of any cases yet in Baines, but there will be cases, we can expect that. Okay, thank you. Just go on to the second slide then, please. So what can we all do locally to help? Jill's going to talk about getting vaccinated, and that's one of the most important things that we can do. We all absolutely want to keep our freedoms. We enjoy our freedom and being able to live our lives as normally as possible. So in order to do that, we do need to build into our everyday lives some of these precautionary measures. So the getting vaccinated, wearing a face covering in crowded and enclosed spaces, and that's now become mandatory. So that's now law in shops and on public transport. Taking a lateral flow test regularly, I've covered. If anyone has COVID symptoms, and if you're not sure if they're COVID symptoms, just be precautionary and assume that they are, then self-isolate and take a PCR test. If you have a cold or flu-like symptoms, then the advice is to stay at home. And then the advice also is around letting fresh air in. And there's a new national campaign about every hour, recommending that every hour, if you're indoors with people who you don't normally meet, then open the windows for a few minutes to let the fresh air in and be able to blow out any virus particles if anybody in that room does have COVID. We are putting in some additional support to support businesses, and we're employing somebody, the first person is starting tomorrow, who will be able to support businesses and go around businesses, particularly public-facing businesses, so shops and entertainment venues and restaurants, cafes, etc., to support them in putting up posters to encourage people to wear face coverings and to make it easier for them to practice hand hygiene and to be able to sanitize their hands when they move in. So that will be some support for businesses and entertainment venues. Thank you very much. I'll hand over back to Will or to Alan, to the chair.
I think next, if we go to the next slide, I think I'm just going to ask Jill to come in. Yeah, Jill, over to you.
Thank you very much. My goodness, what a difference the week made when I spoke about this last week. What I would like to just maybe spend a bit more time on is what do these changes mean in terms of the increasing and expanding the invite. But firstly, just to say, we know the benefit of the vaccines across Bath and North East Somerset. The uptake has been fantastic. We are certainly, you can see this has changed. 37 boosters have been given already. We are doing well in terms of children aged 12 to 15. And what we have been pleased with is that we've been able to support Virgin as they have gone into the schools to offer a supplementary offer by carers and parents taking anyone aged 12 to 15 up to the racecourse. And we've seen a lot of children go through that site. So last week, we knew that if you were aged 40 and over, you would be invited for a booster vaccine. So we know that the profile of when that age group had their second vaccine, it is in early December that we would start to see them come forward. You will have heard yesterday that anybody aged 18 to 39 will also be invited. However, this is the difference. Up until Monday, that third booster was given within 6 months of having your second vaccine. Yesterday, that was brought forward to 3 months. Therefore, you will appreciate we are now re-looking at our demand and our capacity to ensure, and I believe Boris Johnson has done a brief live now that commits, and this is what we have been given, that every adult will have been given their booster by the end of January. So what that means here, we've put in here a weekly vaccination clinic is in place. Well, all of this now is up for review. So we are looking what additional sites can be set up, how can we expand the offer at the racecourse. But I do want to emphasise, we have a very clear message. We need to concentrate on those people aged over 50, but particularly those aged over 70. We are doing well with our care home visits, but we are needing to really concentrate on those people that are housebound. So I think it's fair to share with you, and Dr. Bryn Bird will come in after me around the pressures. Our workforce are our challenge. We have a workforce that is spread incredibly thin, and we're all trying to get people to do the various, whether it's vaccinations or to do extra shifts within our hospitals and our community settings. So there is great pressure there. We do know that any child aged 12 to 15 will also be invited for a second vaccine after Christmas. But we are wanting to make sure the flu vaccine offer is not compromised by this. So we have to deliver both. Next slide, please. So this is a slide that just gives you an overall position as to how well we are doing. And I think it's really important. This number has indeed gone up. It's an old slide, but 1.641 million people have had a vaccine. And again, what we are doing, we use the word cohort here, but this purely references the age groups that people invited. So all I really want to say to you all is this, is that we are working hard to make sure there is accessibility for our population to come forward. We still know that we have got about 100,000 people across Spain, Swindon and Wiltshire that are still yet to come forward for a first vaccine. So we still want to do work to invite people to come forward. But the biggest message I want to give you is people will want, the National Booking Service last night was just flat out with people wanting to get that booster. We do not want somebody aged 18 getting a booster before somebody who is in their 70s or their 50s. So we do want to give the message, please be patient and wait to be invited. I'll hand over to Bryn now, then at the end, happy to take any questions. Thank you, Bryn.
Thank you, Jill and Becky. Very interesting to hear those updates. A completely different sort of take on it from when we last heard them last week. So shows how present and how live and evolving the situation is. I was just going to come in briefly just to update the forum on the pressures on health and social care and give a bit of setting to that and what it means to us all involved and to our population going into winter. And just to give it a bit of background, because it's obviously something that's come up quite regular in the media on the pressures. And for background, I'm a local GP, and so I completely understand how frustrating it is for patients when they can't access healthcare in the community at the time, appropriate time. I just wanted to put that into a little context of the demand currently faced in primary care and how that's reflected in other areas of the system and the knock-on effects of that. So some of the factors that are increasing the demands are particularly related to the pandemic. Firstly, the infection prevention and control measures that we continue to have to deploy in healthcare settings, and it's vital that they're considered very different from, your local pub or restaurants, in that we're protecting the most vulnerable in society and those at highest risk. And in running such infection control measures, that often leads to quite a bit of inefficiencies in how we're running our days in balancing between remote and face-to-face access. But it's important that we continue to do that. So whilst we offer face-to-face to anyone that that needs it in primary care, and that's all has been the case for a long time. We can't particularly go back to the free flowing and the footfall that was prevalent, that was the norm a couple of years ago in how healthcare settings were run. And obviously appreciate the context we've just heard. That's important as ever in the pandemic going into the winter. The other pressures have been faced, the delays in presentations of medical problems during this time, especially last year, and that's been for a variety of reasons. But the upshot of that is that the physical healthcare we're dealing with is often more complex and is more demanding on services. And that's not to say the new and exacerbation, the worsening of mental health concerns during this time has been very real and very prevalent, and something I and colleagues experiencing every day, which is an ongoing concern and challenge, and one that's very real and prevalent, and indeed, unfortunately, is quite, again, a demand on our services. Then, of course, there's COVID itself, which still is here and active and prevalent and causing symptoms that we're dealing with, both in the short term and then, as we've heard about, long COVID as well and the effects of that. And finally, as Jill's mentioned, there's the vaccination programme that's been predominantly delivered in the community. And while it has some variants at the moment, we're continuing to pull on the same pool of staff. So as Jill was mentioning, there's demand faced or requirements faced in other parts of the healthcare service and care service, but with the limited slack, often when we're setting up a service or aiming to support one area, you're often destabilizing another. So these are some of the pressures behind the scene. And then there's the effect on our staff. So not only is there quite high rates of burnout and sickness, also there's the isolation measures, and that was very real to me only yesterday with a potential contact in my household who I had to have their day and working from home from clinic, and that is happening consistently amongst our colleagues. So these are just some of the background, but we appreciate that is very difficult for our population when they're not receiving some of the care that is required. But with that, there is knock-on effects in hospital waiting lists, and that is aiming to be addressed nationally and locally, and we are working in that, but then it's still very prevalent that patients are struggling to be seen as it would have been 2 years ago. Can we have the next slide, please? Okay, so what we can do to help locally. So some key messages in here. And the importance of this is that our population and patients are attending the most appropriate place for the level of care required. So we'd encourage practice in self-care. So that we have our NHS app, websites that can give excellent self-care and advice from pharmacists. So we're increasingly using our pharmacists for more minor illness, that they can give recommendation. Oh, can we go back one, please? Thank you. That they can give recommendations and the appropriate medication. And if there's any doubt, we're encouraging the use of 111 and online 111 online as well, to get the appropriate level of advice required. It's also important to mention our community wellbeing hub for those that don't necessarily have an obvious medical need, but perhaps experience some isolation, some mild mental health symptoms, and just need that bit of support, be it around food, socializing, or companionship. We encourage the use of the wellbeing hub to support that cohort. And of course, final one, to use 999 when necessary for life-threatening emergencies. Okay, thank you. I think I'm handing back over to Will.
Thanks, Bryn.
Will, could I just interrupt for a moment?
Sure, absolutely.
Jill, there are some questions in the chat. Perhaps whilst it's fresh in the mind of those who posed the question, could you have a look? Are you able to get to chat?
let me take a look whilst Will's talking. Yeah.
Are you okay for me to go on, Councillor? Are you all right? Is that right?
Yeah, that's fine. Then we'll slot those in as we can.
No problem. Okay. All right. So if we can go to the next slide, please. And okay. So, I'm just going to talk a little bit about the financial impact on the council and just explain to you what we've been doing. So, if I roll back first of all to April, May 2020, you know, we were, and again, I'm not a politician, I'm not making any political statements at all. These are just matters of fact. We were one of the most impacted councils across the country, principally because a lot of our budget is supported by income streams, particularly from car parking, from our commercial estate, and also from our heritage estate, so things like the Rowan Baths, etc. So in our 2021 budget, so up until March 21, our budget had £45 million worth of income that was supporting the budget and therefore supporting service delivery. We lost £30 million of that income between April 2020 and August 2020. And you know, any organisation that's faced with that would have been put in a pretty difficult position. So you know, we started having conversations with government departments very early on, and one of the things that came out of that was the government support scheme that came into place in July 2020. We also put in place a very significant a recovery programme. And again, we put, you know, I do believe that we responded more quickly than others, principally because we had to. So not only do we have a lot of income, but we are one of the lowest funded councils again across England. And because we've got a relatively aging population, we've also got real big demands on social care. So our funding is quite low. We're very reliant upon income, and we've got very significant demands. You put those three things together, and actually what we've had to do is to completely restructure the financial foundations of the council over the last 18 months. And doing that at a time where obviously we want to keep frontline services going as much as possible, dealing with the impact within our own workforce of COVID, and you know, dealing, I think, with, as this has gone on, it's been more, I think everybody has felt you know, more jaded and much less resilient than maybe people were, you know, 18 months ago. So we responded very quickly, and because we did that, and because we worked with government, we were able in 2021 to actually balance the budget, and we were also able to put some additional money into the reserves. What that enabled us to do was for this financial year, for 2021-22, we've still got a reduction in our income, but rather than being 30 million, it's about 15 million in this year, because it takes time, obviously, for things like, you know, car parks to people to come back in. It takes time, particularly we've had to renegotiate a lot of the commercial rents. So there's still an ongoing issue in terms of the income that's received by the council. But we've been able to do that on the basis of a balanced budget in 2021 and the reserves being topped up, which has enabled us to have a much more robust and sort of measured approach to our financial position, and also maintain frontline services as much as possible. So as part of the 2022-23 budget, which, as I say, there'll be a separate event on the 14th of December, we are fundamentally rebasing the budgets that you know, that are taking into account those issues that I've talked about, and also you know, how we are continuing to respond to the pandemic. So we know that some of the issues are probably shorter term, so we hope that some of the workforce issues are more short term in terms of the impact. Some of the income effects, but probably much more long term. So again, we're going through a process of really trying to understand exactly how the budgets will be affected over a period of time. At the same time, what we've also taken opportunity to do is to really look at the way that we deliver services and think about modernising stuff and future-proofing stuff. Now, that's not just about saying, all right, well, we'll force everybody to deal with this online. It's actually about having a really root and branch conversation about the model that we've got in place for adult social care, how we actually deal with people's needs. So, for instance, we've still got a lot of people who go out of bounds in terms of their care. Actually, can we create systems where we can bring those people back in, and therefore that's cheaper. So there are lots of conversations going on and lots of work we're doing to try to future-proof where we are, and that will become clearer over the next few months, and obviously as part of the 22-23 a budget proposal, you'll see that. We're also looking at how we can generate more income to replace some income that we've lost. And I say we're trying to do that in a way that has the least possible disruption to frontline services. Go on to the next slide, please. And we're doing that in the context, again, of being very honest and open about the pressures that we've got. So if you consider, for instance, a lot more people obviously working from home, and obviously in the early parts of the pandemic, people of the lockdown, etc. One of the consequences of that is more people staying at home, producing more waste, producing more recycling. So we've been picking up a significant increase in the amount of recycling, because you create more and you create more material in the marketplace. The income that we are able to receive for the cardboard, for instance, and the glass, etc., is less than it was 18 months ago. So again, we produce more waste, more recycling. There's a cost then to collecting it, and we're not able to generate as much income from then selling it. So again, faced with that equation, that creates more pressure. Our electricity contract for our street lighting came to an end at the end of September, and people will know obviously that electricity prices have gone up very significantly in the last couple of months. We were faced at the end of September with a £500,000 increase in our energy bill for street lighting. Well, we can't just go, all right, we'll switch all the street lights off. We've got to pay that money out, but then try to work out how we can still manage the finances of the council effectively. So those sort of things come along, and they create real pressures in the organisation and real pressures on how we've got to manage that situation. You'll also have heard a lot, I guess, over the summer about the national shortage of HGV drivers, and that has had an impact on elements of our resilience, particularly around our waste and recycling services. And there have been a few instances over the last few weeks where, unfortunately, we've had to reschedule some collections. We haven't been able to do some collections. I think we've tried really hard to make sure we've communicated that through our website, through social media, etc. And again, I think that's more of a short-term issue, but it's important that we're really open and honest about some of those pressures, and asking people to have a bit of patience with the fact that that's nothing to do with people not working efficiently. That's got to do with a structural issue that many other areas of the economy are facing. So in the same way that when I walked into Sainsbury's today, many of the shelves are empty because they're having difficulty in terms of sustaining their traditional business model. Exactly the same with the council. Bryn's talked about some of the challenges in the health service. We're no different. I guess to a degree it's more obvious, and people will obviously say they pay council tax that supports our service delivery. And we understand that, and we understand the frustration, but again, we're just trying to be really open, honest about where we are. So we are absolutely prioritising frontline services. We are trying to make sure that we keep everybody up to speed, but we're also saying that as we go into the winter months and the weather becomes more challenging, we may well see some more challenges. We still, we do have staff off with COVID and people self-isolating, etc. Particularly in the last period where a lot of children were driving some of the numbers that, that then drives issues around childcare, which actually puts pressure on staff in terms of their childcare, and then that then drives more sorts of challenges around service delivery. So, we know the next couple of months are going to be difficult, but as I say, we also believe that is probably a more short-term issue, and we just want to make sure people are aware, and we'll ask the people's patience to make sure that we keep people updated. Let's go to the next slide, please. So I'm going to hand over. I think Councillor Ball's on the line. I think he's going to talk a little bit about some of the policy priorities.
Yes, thanks, Will. This is probably the worst presentation of the night. I wasn't expecting this to do this at all. Here we go. You see the slides in front of you. We need to keep recycling as much as we possibly can. This helps keep the budget more in line itself. And it really helps our recycling teams if you can sort your recycling as much as possible and keep it in the right order. Packaging as much as possible, deflate your cardboard collection, makes life easier. One big issue that we had last year was Christmas wrapping paper. And we had to announce last year we could not collect Christmas wrapping paper at all for recycling, because basically it's contaminated with plastic waste, people's ribbons and people's ties on their presents. So that's another thing we have to pick up and take on board. Please try and keep things separate as much as you possibly can. The tips on energy efficiency of warm homes are from the Energy at Home website. Please look into that as much as possible, please. Next slide. Looking after communities this winter is very important. We all look after each other. The Community Wellbeing Hub offers a range of services to help people who are feeling lonely, anxious, housing issues, accessing food and transportation, medication, achieving healthy weight. Please advertise this to your residents as much as possible. Get it out in the community. It's important that all our people feel well this winter and in touch. Next slide, please. What can we do to help locally? Well, I think it's all very obvious what we're looking at there. All these slides are there who you can contact when you have an issue to raise. And please share this as much as possible amongst the residents locally, because it's very important everybody gets help they actually need. It's all as much important as we all stay safe this winter. COVID's around, the flu season's around, a lot of confused people out there as well who actually need help, who probably don't know how to get it. So please make sure it goes as much as possible. That's it for me.
So that's the end of that presentation, Alan. Obviously, we're more than happy to try to answer some questions if people have got them.
All right, well, thank you for that, and very well done to everybody who's presented, because we're actually on time, so that can't be bad. That's a bonus. I think Becky has picked up many of the questions and answered them via the chat. I think that's right, Becky, isn't it? Yeah. And also, Jill, have you responded in that way, or were you going to come back?
Yes.
What? Yes, you've done it on.
I've done it on chat.
Lovely.
Yeah, the ones for the vaccine, I've done it. Yeah.
Okay. Thank you for that. I know that Sarah has nudged me to say that she will be putting those questions and answers into the report of this meeting, which will come out tomorrow, or which will be prepared tomorrow. I don't want to put them under that much pressure. So from that perspective, now, I don't know whether there are any questions for Will. I know I saw one in passing about the panels, I think, and we've got another one from Chris. Is that a question, Chris, or is that has this disappeared off of my screen?
I suggest we take the presentation down so we can maybe see people as well.
Yeah.
Okay, that's good.
Good suggestion. Well done. That.
No, it's just it's just something to not to be answered now, but perhaps the recycling people can have a look at it.
Yeah, that's fine. Absolutely fine. Now we've got 20 minutes or 25 minutes, or there, oh no, 20 minutes just under, for any questions or any points that people want to bring up. So if you have any questions, could you either indicate in front of your camera or indeed with the hands? Barand, please ask your question or make your point.
Good evening. I'm from Compton Parish Council. One aspect that has become clearer over the last couple of years is that when it comes to street cleaning overall, we haven't had anything in the way of anything coming through clearing our the sides of our lanes, and we haven't had our drains emptied since August 2019, and the next time is due February 21, and then quite a few got omitted because they were so blocked they couldn't be seen any longer. The fact that the sides of the roads are not being addressed means that the edges of the roads are now sticking out further than the drains are. So the water is dashing past the drains, which is causing problems down the line. And I brought this up at a parish council meeting, and it suggested I should bring it up at the next liaison meeting, because it can't be just Compton Parish Council that's suffering from this shortage of attention. And I can understand there's a shortage of resources and costs, but the long-term effect is going to be more costs, because there's a lot more to be cleared up that'll take physical manpower when machines won't be able to do it. Okay, yeah, that's a fair question. And as you say, it's probably common to other parish councils. So I think it would be reasonable to ask Will to take that point away and come back with a considered answer, so that that can be shared with all parish councils. Is that okay with you, Will?
Absolutely, yeah, we'll do that. Absolutely.
All right, thank you. Thank you, Baron. Anybody else? I haven't got everybody on my screen, but I'm sure that Sarah. No, we appear to be short of hands. So that's always a good sign that most points have been covered by our speakers, which I'm very grateful for. Our sort of last time of asking, if you like. I put Chair, I put my hand up again for another question, probably for Will. Yeah, okay. If I may. Yeah, please. We've got a big, I see Alistair smiling because he knows what I'm like on the local council. We've got a big reorganization due to be going on at Pixash. And a question I've asked of Alistair is, what can we be doing within Baines to put in one of those super machines that other councils have, that takes all the rubbish and does the sorting at that end, rather than relying on all your residents to do the job properly. And there's a lot of sorting that goes on or doesn't go on. And then at the end, there's a lot of problems because it's not sorted very well. You've got a lot of people collecting rubbish and putting them in lots of little bins. What's the option of getting a machine to do it? I know it needs capital investment, but I believe the council can raise money for what could be long-term benefit in sorting the rubbish and less going to landfill. Okay, well, that's another question I think that really needs to be taken away by Will, so that, again, a considered answer can be given. I know that I went to the recycling centre the other morning, and our recycling figures were up around about the 70–80%, as I recall. So we are doing very well. I know that education goes out to our communities from time to time, and clearly that's perhaps something that the parish councils could have a more intimate input locally to. But I'm probably giving my own opinion here, aren't I? But at the end of the day, it must be better to educate the community in the round as to what we ought to be doing, than saying throw it all into one big bin and we'll deal with it. Because at the end of the day, the people who are not now doing it are now paying money for it to be done by the council. So I'm sure we'll come back to you with an answer to that, but that would be my own personal opinion, which perhaps as a chair I shouldn't have put, but there we go.
Certainly agree with that, and I certainly agree with you too that Baines is a lot better than many other councils in the country what it does recycle. And in Compton Dander, we have started a programme of collecting together items that are not recycled by Baines as yet, but we're collecting those to pass on to places where they will be recycled. So we are doing things locally.
That's great. Well. And perhaps we ought to give a nod or a thank you to Tesco for the sort of miscellaneous things that they take, which, you know, however hard you look at an article, you think, no, it doesn't fall in the appropriate classification. So it probably goes to Tesco.
Absolutely.
Wendy, you have a question, and that will be followed by Chris, and that will be followed by Philippa. And Baron, is your hand up again, or is that? Oh, it's come down now. Okay, so Wendy, please.
Thank you, Councillor Hale. Yes, I'm Wendy Lowes. I'm a liaison officer with the England Illegal Money Lending Team. More and more people, because of the pandemic, are turning to loan sharks. And also with the heating and energy bills going up, there's going to be, again, more and more people turning to loan sharks to pay for that. I was just wondering if I could do a presentation at one of the councillor meetings or a forum so people know about our team, and if they do come across somebody who's a victim of a loan shark, that they can come to us for help. Is that possible at all, Councillor
Wendy,
Hale?
that's a great idea. I know that Sarah and Alison are always happy to receive proposed presentations. I mean, it won't happen immediately.
Oh, sure.
Well, no, I shan't say that because I don't know what their program is. They just put it in front of me and I press one of the two buttons. So yes, if you would make contact, or I'm sure that Alison will make contact with you, and we can make that happen in the future. So thank you very much for that offer.
Thank you very much, Councillor Hale.
Okay. Chris Hounsell.
It's just another recycling question, actually. Whether your people could give some indication as to how clean things need to be that can be recycled. If I've cooked something in foil, I'm never sure how much I have to clean it before I can recycle it. Same is true with some of the other things that we get, you know, jars, you have to get the label off and all that sort of thing, which makes, and I can't be the only person that thinks, well, perhaps I can't recycle that. If they could do some pictures on the website or something like that and say, you know, if it looks like this, please don't put it in the recycling, but this is fine.
So we can look at that. I mean, I think, you know, the honest answer is as clean as possible. It's the honest answer. So people can just help us with that. But yeah, look at we can look at giving a bit more information out. But you know, yeah.
Thank you, Will. That's grand. Philippa.
Hello, thank you. Yes, mine is related to Chris's comments actually. I think it would be really helpful if, along with on the regular weekly council newsletter, if there was a regular slot for recycling to keep reinforcing things like there are still people who don't really believe that the council does do things with our recycling, that it doesn't just go to landfill, and we need reassurance that it isn't a waste of time, and exactly what Chris is saying. I think you know, people don't know things like I've heard that a Liam Perrins bottle, you don't have to struggle to get the plastic off because it's all just going into the glass, just gets crushed up to be part of a road, part of roads rather than making new bottles. And I've also heard that if you don't have your foil in a thing the size of a football sized lump, it's not worth. I'm sorry. It's not worth putting it in because it's not picked up. So at Christmas coming up, a few foil sweet wrappers. You know, I usually put it in a plastic carrier bag, all my foil, but I've not been putting it in for a while because I don't know what it's. I've got a load building up.
Okay, well, thank you for that.
More education and continual reminders of little things rather than a really complex document that we don't trawl through, just chip away at it continually.
Yeah, well, a note will have been made of that, and I'm sure Will has taken that on board as well. And because obviously I'm sure that as a council, we are eager that everybody does as much as they can to recycle. Because, you know, it does save us money if it's not going to landfill. And in fact, we earn money if it goes to recycling, or I assume we still do. Yeah, Will's nodding, so that's fine. Yeah, so all of those points are very well made. I can't see any other hands going up. And I'm not going to tempt fate by waiting too long. No, nobody's putting their hands up. So just a couple of reminders that the CCG has a survey, Shaping a Healthier Future survey. And the CCG is seeking views about a new health and care model and conducting a survey, as well as holding online workshops on the 8th and 9th of December. So if you can seek that out, that would be good.
We'll send the link.
Sorry.
We'll send the link tomorrow.
Okay. I'm just told that a link will be sent out to everybody present. Also, you've heard it sort of given due notice tonight. There will be the council special online budget discussion, 14th of December at 6 p.m. What else? We will circulate. Sorry, I'm reading off of a screen. I was reading off the screen, but anyway, it was the last line, which basically says that we will be circulating the papers from this evening, which will give you the questions, the answers, and it will pick up on other things that have been asked. And as has been said, Will is going away with a crib sheet of a number of questions, I'm sure, and through various means that those answers will come back to us. So can I thank you all for your attendance this evening. It is a good attendance, and it makes it worthwhile from the point of view of the people who come to speak to us, that they can get their message out, because you will talk to your friends about what you've heard, I'm sure. And so the message will spread. So thank you very much for your attendance. I think it's safe, because I don't think it's in my diary anywhere, to wish you a very early happy Christmas. We could have wished you a very happy Christmas in September had we been holding it in a garden centre, but we weren't. So have a great Christmas, folks. And to those who've spoken this evening and the officers that have supported this, can I give a very big thank you for everything that you do for us. And in the name of the council, it is appreciated. And despite the discussions that take place on Facebook, I believe that the majority of the community support what we do and appreciate what we do. So thank you to all of you, and have a nice rest of your evening. Thank you very much.